Hi, I'm Dr. Devendra Naik. I'm a Chief Medical Officer at Svatantra. Our approach at neuro-rehabilitation is centered at one principle: the right intervention at the right stage for the right people. One modality that fits this principle particularly well in early and subacute neuro-recovery is hydrotherapy. So here we have Dr. Nidhi, our lead therapist, who is going to talk about the hydrotherapy and its benefit. So tell me, Dr. Nidhi, so why do we need this hydrotherapy?
So when the patient is going through the stroke, prolonged ICU stay and the traumatic brain injury, early mobilization is often limited with the postural control, joint stresses and often with the cardiovascular stresses.
So from medical point of view, so these limitations can delay the functional mobility even when the neuro recovery has already begun.
Yeah, correct, doctor.
So how do we enable movement without increasing this risk and strain? So how does water change this equation?
So water has its own property, which is buoyancy, which help in reduces the weight, body weight. The second property is the hydrostatic pressure, which enables the postural control. Third but not the least property, which is water resistance, which enables the control muscle activation.
So this environment allows the early task-specific gait practice with the reduced joint stress and improved safety.
Yeah, doctor.
Okay, while still providing the meaningful neuromuscular engagement.
Yes, correct.
So tell me, doctor, how does it add?
So in Svatantra, we have one more additional phase which is known as Aquatic Treadmill, which make it more interesting. So I'll explain you how Aquatic Treadmill works. So Aquatic Treadmill training allowed to work on a gait pattern and the balance for the patient who is not ready to put their full weight during the rehab thing. And this Aquatic Treadmill training is evidence-based program which we are leading it.
So it reduces the risk of fear, cardiovascular load, allowing patients to tolerate better training and for a longer duration.
Yes,
correct?
correct.
All right. So Dr. Nidhi, when and how we use it?
When it is integrated with the multidisciplinary rehab program, the hydrotherapy plays a very important role in the early mobilization and for the functional progresses for the patients. So if you and your patient is recovering from stroke, traumatic brain injury and from the post-prolonged ICU stays and walking feel heavy and exhausting, this is not always a limitation, it must be workout.
So this is how we use hydrotherapy at Svatantra as a part of a structured, evidence-based neuro-rehabilitation. So recovery needs more than the efforts, it needs the right intervention at the right time for the right persons. So stay tuned for more such contents.